Good evening, ladies and gentlemen. Welcome to yet another interesting topic that affects everybody on earth. You see, one thing we need to understand is that we are born of men and women. And that means even if you're a woman, this topic affects you. I remain my humble self, Lucky, Dr. Drugs. And it's a pleasure to be here once again talking about prostate health, talking about taking charge or taking over your throne as a man. So, prostate challenges and management. As you can see, you look at it, my screen over here, you can see we have two bladders. If you look at the bladder on the left, you can see a teardrop in the eye of that bladder on the left. It's crying. While you see the bladder on the right is very happy. But if you look closely, you can see that there is something that is blocking the urine on this left side, and you can see that it is very free on the right side. That's the big difference between the two bladders we're seeing here, and hence our topic of interest for today. So I remember my humble self, Dr. Drugs, and our table of contents will naturally go thus. We promise to make it very brief and very easy for us to understand. Now, we can't talk about prostate health, start talking about the human prostate itself, and definitely the types of prostate health challenges. Talk about maybe about 2 or 3 common types: signs and symptoms, causes and risk factors, of course, as you can see. Then the complications, diagnosis. Some of us hear about prostate-specific antigen, PSA, but we don't really know what it is. We don't know why it's important. We'll find out shortly. Then, how serious is this issue of prostate health in this part of the world? We'll find out as well. Then we'll talk about the challenges in the management, the prevention, management of prostate challenges, as well as the importance of the use of natural pharmaceuticals in the management of prostate issues. Now, the prostate gland is a muscular walnut-sized gland of the male reproductive system. In fact, the word prostate means guard or gateman, and is the guard at the gate of the bladder. That means any problem in that area will mean that urine may not be able to pass through, amongst other issues or complications that take place. But the prostate itself is not just a gate man or a security man that just stays there, but it also has its own functions. And these functions even play a very large role in fertility. So we're going to find out shortly. And of course, via its ability to secrete what is called prostatic fluid. Just to know a tip of what the prostate is able to do is that it also makes the environment neutral for the semen or the spermatozoa to swim to the egg, because we all know that the entanglement arena of the women is actually can be a bit acidic, and this prostate tries to help to prostatic fluid tries to help it to be alkaline, so the sperm cells don't even die before they get to where they're going to fertilize the eggs. And you can see that just one of the functions. Talk about a bit more on that shortly. Now, what this means is that a faulty prostate can lead to infertility. That's the long and short of what I just said. And it controls the traffic between urination and what? Ejaculation. Guys, you know what I'm talking about. You know you cannot do the two at the same time. You see that? And that's thanks to what? This very wonderful organ here. Now, the prostatic fluid consists of proteolytic enzymes. The grammar seems long, but it just means enzymes that what? Break down proteins that make it difficult for the spermatozoa to swim. It also contains prostatic acids and something that breaks down fibrous, anything that is fibrous or anything that makes or slows down the process of sperm swimming to where the eggs are. It also plays a very important role in regards to that. And of course, zinc and a lot of other things there. I usually ask this question, and I would like us to just take a wild guess. Do females have a prostate? You can just put the answer there, yes or no, and we'll talk about that shortly. That's just on the lighter note. So more facts about the prostate. You can see the man in front here looking like someone that is about to be given 24 strokes of cane and was told to face front. You understand? Because he doesn't know what's going on back there, and you can see the health practitioner preparing to investigate by digital probe or examination. And what this means is that starting from the age of 40, hormonal changes begin to make path where the urine passes is also where the seed of the man or the semen passes. So you can see that the pain is not only is not only for the issue we talked about when we talk about urination. Then, of course, sudden and uncontrollable urge to urinate. You see some people will be very quiet, maybe about to receive Holy Communion. They say, Father, wait, and they are rushing to the toilet to go and urinate right in front of everybody in church. Brother and sister in the Lord, that person may be having prostate issues and needs to find help urgently. So the causes and risk factors of prostate health challenge include hormonal issues. You see, there's a hormone that actually makes men have their male sexual characteristics, and that's called testosterone. But the byproduct of this testosterone can actually increase the rate at which the prostate cells replicate and can make the prostate cell begin to enlarge. In fact, a lot of drugs that we use today to resolve the complications that arise from prostate health challenges are based on this information I just gave. They block the production of that thing that is produced from our male sex hormone called testosterone. And the thing that is produced is called what? Dihydrotestosterone. So let's just call it DHT. Now, DHT is produced in everybody, of course, and because the 5-alpha reductase enzyme, an enzyme is just like a catalyst or something that makes something to move faster, helps to convert testosterone to DHT. So, of course, you can see that when there's a high level of DHT in the system, you find out that the prostate begins to enlarge faster. And estrogen, funnily, a lot of men don't know that we men also have some level of estrogen in our system. And of course, an increase in that would also worsen prostate enlargement or benign prostatic hyperplasia, BPH. Bacterial infection is not left out. That leads to what is called prostatitis, enlargement of the prostate as a result of inflammation caused by the bacteria causing havoc there. Of course, prostate cancer is not left out. We'll talk about that shortly because cancer is simply uncontrolled detrimental replication of blood cells and of tissue, of cells in the body, of the affected part, sorry. Then we have DNA damage that actually leads to cancer. And that actually may also support or promote uncontrolled replication or multiplication. You see that the liver also plays an important role because, believe it or not, when people are having things like fatty liver disease or having liver cirrhosis or having hepatitis, yes, hepatitis like hepatitis B and all that, it can actually later lead to issues in the prostate because the liver also plays a large role in managing the amount of sex hormones like testosterone and estrogen in the system. Of course, trauma. Imagine somebody playing football and maybe Ronaldo was trying to kick fire a very hot shot into the net. And unfortunately, instead of kicking the ball on the floor, Ronaldo mistakenly kicks the ball in somebody's shots. I wonder where the prostate will be. That prostate may not be in good condition. In short, that prostate may have a headache. And you can see that trauma may lead to that issue. Age, has been explained before, as men grow older, the prostate actually gets larger. But the problem is whose prostate is getting larger faster than the other. Sex. We all know that women basically don't have, I asked a question earlier, but women don't have that physical prostate, but those that we'll talk about that. But women actually do have a reduced prostate called the Skin's gland, and that just gets at that. Type 2 diabetes is not left out because, you know, type 2 diabetes is actually a damaging director. What it does is that it is a disease of diseases and affects almost everything you can think of. It can affect anything in the body, including the prostate. In fact, by supplying sugar to the cells, it gives these cells more energy to multiply even faster. Sugar itself is inflammatory. That's why you see that Oftentimes, when you go to the dietitian, the first thing they tell you to do is to reduce sugary beverages or refined sugars or refined carbohydrates. Okay, obesity is not left out because you know that obesity is a lifestyle disease that will lead to other lifestyle diseases. It's the mother of lifestyle diseases, which include fatty liver disease, high blood cholesterol, and a lot of other diseases, even type 2 diabetes that could affect the prostate. Poor dieting can lead to obesity. That's a link. Caffeine, excessive caffeine intake, high blood fat, low zinc, low vitamin D for those that don't go under the sun at all, sit inside the house watching Netflix 24/7 and 7 days a week and 365 days in a year. You need to go and put your body under the sun to produce the sunshine vitamin called vitamin D. And you can see that this practitioner here is not joking as he is giving us this one. Now, what are the types of prostate health challenges? We have prostatitis, which is inflammation of the prostate. And it can be as a result of what? Bacterial infection. Some people have prostate issues. They have already concluded that their prostate is gone. Whereas it's just to take a very simple antibiotic like ciprofloxacin tinidazole combination. I'm not saying that you should go and buy that. I'm just saying that's one of the things that I often prescribe. So you have to make sure your doctor does that for you. And the thing disappears and everybody begins to shout, what God cannot do does not exist. But you can see that it also has a common kind of complication, which is blockage of urine flow. And you can see that this bladder here is shedding tears because of an inflamed prostate. So the symptoms often include painful urination, ejaculation, growing pain and difficulty in passing urine, fever, because the body tries to kill the bacteria by increasing its temperature. That is the reason why we have fever and so on and so forth. Now, this is very common. You see that this bladder is really trying to squeeze urine through. It's trying all its best, but guess what? This prostate has been enlarged and is not allowing the urine to pass. It's just like a gatesman or security man that is very stubborn and refuses to open a gate for his boss. And you can see that the boss will be at the other side of the gate, furious, as you can see this bladder here. He's trying to squeeze urine through. So now, benign prostatic hyperplasia simply means enlargement of prostate due to an increase in the number of cells that make up the prostate from any cause that is not a malignancy or cancer. That is the basic definition. So it's often noticed when urination becomes more difficult. And the symptoms include frequent urination, difficulty starting urination. Then we have poor or blocked urine flow, painful urination, and so on and so forth. Of course, we know that erectile dysfunction and other factors that affect entanglement will also be affected. Now, in situations where the prostate gets too large, it blocks urine flow, causing urinary retention. And guess what? A backflow of urine from the bladder goes back to the kidneys, causing kidney issue like hydronephrosis. That's not a good thing. So as men grow older, the number of cells in the prostate actually increase. And testosterone, which is the male sex hormone, is converted to dihydrotestosterone, what we call DHT for short, which is rapid increase in number of prostate cells. But guess what? A biopsy is often indicated for a diagnosis as well as PSA, that is prostate-specific antigen. We're going to talk about that shortly. So let's just stay tuned. Prostate cancer is quarrelsome and invasive. That is why it is called malignant. It's a malignant increase in the number of prostate cells. Remember that the definition of cancer is simply excessive, uncontrolled, detrimental replication of cells. That is definition of cancer. Very simple definition. So the symptoms are similar to that of BPH, but may include weight loss, because you know that when there's problem, people begin to, in fact, and once a problem becomes too long, something called cachexia, which is unexplained weight loss, begins to take place. And it also happens to patients that have chronic diabetes. You see that they begin to lose weight, and some of them begin to worry and all that. Some also, even if I had a patient recently that had an idiosyncratic condition that nobody knew what was just going on. But she, all of a sudden, began to lose weight. Just like that. Because whatever the problem was had taken too long, and the body just began to shed weight until we got a solution, and we all had cause to glorify God. And back pain is often not left out because of the spread. Remember that cancer is worrisome and invasive. The other one is benign. In fact, some call benign tumors or benign issues friendly tumors because they don't have problems. You understand? But cancers have problems with their neighbors. That's why you see that when people have prostate issues and the prostate-specific antigen seems to be off the charts or is too high, you see that a bone scan is often done to find out whether the metastasis or movement of the cancer cells from its locality to another area has taken place. That's why that is also done. And of course, the back pain is due to spread or invasion to the surrounding area. Now, let us not forget that DNA plays an important role in what? Regulating the way cells multiply. What this means is that anything that affects DNA can provoke prostate cancer. And number one is who? Diabetes. Diabetes can provoke prostate cancer because it leads to secretion of what are called free radicals or reactive oxidative species. And these love to affect what? DNA. In fact, reactive oxidative species. And where do they like to react to? One of the places they love to react with most is DNA. So what are the complications of prostate issues? Now, this includes kidney damage or failure. Remember, we talked about the backflow of urine. Bladder damage is not left out because there's nowhere the urine is passing, and the bladder begins to what? Expand so much that it can begin to have issues. Bladder stones, because as the urine begins to concentrate, if you remember when we were younger and we used to consume sugar, we pour one bag of Dangote sugar or one packet of cellulose sugar inside one small teacup. When the water is hot, what happens? The sugar will disappear. Then when the water begins to the tea begins to cool down, the sugar begins to what? Crystallize out again, because the concentration of sugar there is just too much. So you can imagine if the concentration of substances in the urine are getting too much, what happens? Bladder stones begin to appear and further worsen the situation. Trust me, passing out a bladder stone is like a car passing through the entanglement facility. It's not a joke. Now, blood in urine is also a problem. We talked about that earlier. Urinary retention, that is because of the blocked flow and inability to urinate, is also an issue. Urinary incontinence, we talked about somebody trying to receive Holy Communion, and we just tell the Reverend Father, please, Father, I'm coming, and he's rushing down to the bathroom right in front of the whole church. Brother and sister in the Lord, that person needs help urgently. Urinary tract infection is not left out because you know that when the urine is stagnant, bacteria can begin to what? Grow there. That is it. Just imagine when one's gutter or drainage system outside the front of their house is blocked, you begin to see that the color of the water begins to what? Change. And you begin to have foul odor come out because the water is no longer what? Flowing. And that's the same thing that happens there. Infertility is not left out because we all know that the prostate plays a large role in making sure that you and I are the lucky ones out of the trillions of other competitors that swam to the egg in our mother's reproductive system and led to our being here. So we are all lottery winners. We are all lucky scientifically. Then erectile dysfunction, tissue damage. That's just basic because you see that when the prostate begins to get enlarged, apart from the fact that it begins to squeeze on other organs, the pain will not even allow the man to even have that psychological backing or morale to perform wonders in the other room. You know what I'm talking about. That's just on one side. They will now talk about the fact that there is blockage of essential things like blood flow and all that to the entanglement facility, and tissue damage as well can also not be left out in cases like that. Of course, damage surrounding egg organs is not left out. And in very extreme cases, especially in case of prostate cancer, you see that death is also a very important issue. So this is diagnosis. The prostate is very close to where the finger is in that picture. That's a digital rectal exam. And you can see that the diagnosis is often by physical check by a urologist. Then prostate-specific antigen is not left. I'll talk about that shortly. A biopsy may be needed, maybe a fine aspiration, just to make sure that the cells are not terrorists or cancer cells. Then we also talk about urine culture sensitivity, because you may be surprised that it's a very stubborn bacteria that is just making that prostate to enlarge, and you find out that once it is discovered, it will be exposed to different antibiotics, and that will help us know the best to use to take care of the prostatitis. That's inflammation of the prostate, especially due to what? Bacterial infection. Of course, radiography and other medical imaging techniques are not left out, and so on and so forth. Beautiful. Now, prostate-specific antigen, you hear once many men get to 40, you start hearing the word PSA. This is what it's all about. The prostate-specific antigen is a protein secreted in the prostate, and its function is to what? Improve sperm Olympics, so that the sperm can be able to swim through the hostile area of the vaginal tract of the female entanglement arena. Now, this is by dissolving semen stickiness. You understand? Because even whether you have a billion sperm cells swimming to that egg, only one still enter. So the female entanglement arena starts from begin to make it difficult, so that it will be like the survival of the fittest. Just as women in real life, we always select the best men, also the female entanglement arena also make sure that the best sperm cells get to the egg, and that is with the help of what? Prostate-specific antigen, to dissolve the coagulum or the stickiness in there. Now, bear in mind that for various age ranges, we have various ranges of PSA. So you can see that for a man that is between 70 to 80 years, the range is higher than for a man that is between 40 to 50 years. As you can see, 0.0 to 2.5 nanograms per mil for men that are within the age of 40 to 50 years, and 4.5 to 5.5 nanograms per mil for men that are 70 to 80 years. Remember, I mentioned that the prostate gland enlarges naturally as men grow older. As you can see here, a larger prostate gland naturally secretes what? A larger prostate-specific antigen volume. So that is just as easy as that. So anything above these ranges is indicative of possible benign prostatic hyperplasia. Generally, levels below 4 are considered normal, but levels between 4 to 10 nanograms per mil may be indicative of a high risk. I do not say the person has prostate cancer. That is left for your doctor or your urologist to determine. It's a high risk of prostate cancer. And levels above 10 nanograms per mil are indicative of even higher risk of what? Prostate cancer. That's why it's very essential that we check PSA level. Now, in this part of the world, prostate cancer is currently the most frequent malignancy in the average male, because about 75% or more cases are diagnosed in men that are 65 years and above. Can you imagine that? But there's good news, attached to this bad news, and I'll tell us later. It's not really a good news, but it's not so bad. Most of the cases occur within the age bracket of 61 to 70 years. Because worldwide, prostate cancer affects 1 in 6 men. If you are a man and you are 60 on your street, know that about 10 of you on that street will most likely have prostate cancer, one way or the other, one time or the other. Now, about 1.6 million men are diagnosed with prostate cancer, and about 366,000 men die of it yearly worldwide. Can you imagine? It's something. Now, prostate cancer is to men what breast cancer or cervical cancer is to women. It has the potential to grow and spread quickly. But for men, it's a slow growing disease. Unlike women that have, although it has the potential to grow and spread quickly, but most men, that's the good news. prostate cancer is a slow cancer. In fact, oftentimes some people have prostate cancer, it's other things that kill them, not even the prostate cancer itself. But of course, we do not know who is going to die of the prostate cancer, so let's no one have it at all. Now, about 20,000 men die of prostate cancer in Nigeria each year. One new case every 3.3 minutes. That means if we have been talking here for the past, let's say 18 or let's say 20 minutes, what it means is that 6 people have been diagnosed of prostate cancer. You understand? And one person dies every 20 minutes. So from my calculation, if I'm looking at my time correctly, that means 2 people have just died of prostate cancer between the time we started talking and now. About 2 people may have died of prostate cancer. So it's a very serious issue. Now, 1 in 5 men will be diagnosed with prostate cancer in their lifetime. We talked about something like that just not too long ago. So what are the challenges in the management of prostate health? Late detection. Some people always believe that it will go, and do not pay adequate attention to their bodies, especially when changes begin to take place. Self-medication, Sabi news, please go down to the nearest hospital to get that prostate checked. Stop assuming that you can eat this leaf or eat that leaf or eat that grass and all that unsupervised by a trained or licensed health practitioner. You must be joking. Now, lack of trained health practitioners. Of course, you and I know that there's a country that's currently maybe the highest exporter of health practitioners on earth today. I didn't mention the country, but you see that many health practitioners, their bodies are here and their spirits may be abroad somewhere. Fake drugs is not left out because of the economic challenges. People want to make more money. Poor compliance, because sometimes people get tired of taking this medication. Poor health infrastructure, inadequate health education, as we're having now. You send some people the link to enjoy free education on prostate health, and then they decide to watch football instead. And then maybe the next week, they end up in a hospital spending a lot of money they could have avoided. That's lack of health education. Economic issues not left out. We all know what's going on in this part of the world. Things are getting more and more expensive. Depression, because nobody will be happy with prostate issues, and in some unfortunate cases, the disease that is greater than all diseases, death, may actually take it. So what's the bitter truth? People keep asking me questions about surgery and this and that. Well, I stand to be corrected, but from the little I know, every year, thousands of men walk into an operating room to undergo prostate surgery. And it's an absolute nightmare because the most common surgery choice for enlarged prostate involves the surgeon literally passing the instrument up the urinary opening of the penis to the location of the prostate to begin to peel it off gradually, the way you peel orange, the way the aboki peel orange for you. That is how they peel it off. And you can imagine the tension in the mind of the man, what's going to happen. And the worst of all is that many men become totally impotent. Some experience added embarrassment of what? Urine leakage. Even after the surgery, the man will sit down. Imagine the owner of a very big company having a board members meeting, and as he was about to stand up to shake somebody, the whole of the downstream sector of his white agbada is already soaked, and he did not have an idea. Well, it's very, very embarrassing. And you can see, I've had patients that had such issues, and I had 1 or 2 ways I helped them to go through it. And I thank God that especially one of them is very, very okay now, and he has become a very good friend of mine. Now, prevention and management of prostate challenges. See, early detection is very important because assuming that it is, in fact, someone may assume worse than what it is, or someone may assume less than what it is. For instance, someone may be having just prostatitis, maybe bacterial infection, and the person is already writing his will and has prostate cancer. But if the person goes to the hospital early enough, they may say, "Oga, don't write your will yet, just take antibiotics, you'll be fine." Dieting is also very, very important. Exercise is amazingly important. Weight management, of course, we know that obesity is the mother of lifestyle diseases that can actually lead to problems that can murder people. Then we have detoxification of body system. That is very important. Surgery, I just described that not too long ago. Now, use of appropriate orthodox medication to get out of danger zone, orthodox medication and procedures to get out of danger zone, like tamsulosin. I know people are popular with because that helps to make the passage wider. That's what it does. But it only makes it wider for as long as its half-life or as long as it's in the system. You know that people that make chemical drugs also have families to take care of. So they give you so that you take, get a bit, well a bit, then when the thing fades, you take again and you are stuck on these things, sometimes for life. The steroid actually helps to counter the formation of that guy I talked about, which is DHT, that's dihydrotestosterone. So let us also watch out for side effects. Make sure you also try to open the leaflet, so don't think that these things are just to chew whenever one likes. There are others like apalutamide and so on and so forth, spelled for cancer and all that. Then we have the use of appropriate natural pharmaceuticals to manage and or prevent issues. It's teaching time. That's where we're going to. Let's see. You see, on top of this fork here, we have this tomato you're looking at there. You see, this tomato you're looking at contains a very amazing biomolecule called lycopene. It's just that before you can get enough lycopene in your system to exhibit the kind of effect you are looking for, one may have spent a fortune. But you see where we get very pure lycopene for our patients. We'll show that to you shortly. Then we have omega-3 fatty acids. These have anti-inflammatory effects. Vitamins are not left out, like the B vitamins, some of them. But bear in mind that when one has prostate cancer, the B vitamins are excluded because they have the potential to make cells replicate even more. That is why you see that when women are finding it difficult to get pregnant, we add B12 and B9 so to help to encourage the egg cell proliferation. Potassium is not left out. Immune boosters are not left out. Selenium and vitamin E, iron, fiber, and guess what? Zinc. But anytime a man ejaculates, have lost a good amount of zinc. So the importance of natural pharmaceuticals in prevention and management of prostate challenges, that they help to prevent and or address what? Hormonal issues, prevent DNA damage, weight management, erectile dysfunction. They help to fight prostate infection, prevent and manage BPH, manage depression, and supply adequate nourishment for optimal prostate health. These products I'm talking about here, I'm not saying that this is what you must use, but this is what I use for my patients, and I get amazing results. And they contain the things that are needed in the best quality, form, and quantity. So somebody said if you know be Panadol, you know if you be like Panadol. That means no matter how anybody can write anything anywhere, but the company that produces these products, Forever Living Products, has been here for heading 50 years. And I think that they are waxing stronger for a reason. So that is why I'm using them for illustration. So focus on the active ingredients, and trust me, you will not regret this knowledge. So Vitalize Men contains vitamin D, vitamin C, which is powerful antioxidant. Vitamin E is also DNA protective. And remember that vitamin E is also very good, those tocopherol analogs as well, in regards to entanglement facility and entanglement factor performance. Then zinc, of course, helps to hinder the production of DHT that we said makes BPH get worse. We have B6, we have lycopene we talked about, we have plant extracts, saw palmetto, selenium, pumpkin seed and all that, even quercetin. Multi-marker helps against hormonal imbalance, and also it contains L-arginine, which improves blood flow to the entanglement facility. Aloe gel contains vitamins and phytochemicals, and of course, it is a somatic stem cell stimulant that helps to take things back to normal and stimulates the body's natural workshop to begin to heal the system. Yeah, so this is what it looks like. But this one on the other side actually contains cranberry extract in addition. So that cranberry extract helps to prevent attachment of bacteria to the urinary tract walls. So you can see that it's going to be very amazing for prostate issues and so on and so forth. So this is B-Polin. It helps to promote the prevention and reversal of BPH. This immune blend, as the name goes, helps to boost immunity as well. Remember that the immune system also fights against cancer. There are cells, white blood cells called monocytes, that God has helped us to do that. Of course, there are other factors in the immune system that help to fight against anything that grows faster than it's supposed to or multiplies faster than it's supposed to. These cells are mobilized down there to take care of it. That's why you see your immune system has to be boosted. And also the immune system, a healthy immune system will ensure that the prostate is not infected by things like bacteria. Remember we talked about prostatitis. We have others as well, and these are natural pharmaceuticals that are given in addition to manage complications secondary to causing things like BPH and other impotence. We have those for impotence. We have the L-arginine and the others. Then we have the ones that are against kidney issues, bladder stones, prostate cancer like the lithium plus and all that. Now, these are others. Just briefly, we have B-Propolis, powerful antimicrobial agent. Garlic thyme will help with stones. The Arctic sea helps with inflammation. Cardio health helps with regeneration of damaged kidneys and other organs that may be affected. The Lithium Plus, of course, is a powerful antioxidant that has goji berries in there that will help to mitigate the incidence or occurrence of prostate cancer. So that's very, very important, because you know that it will protect the DNA from, going haywire. Then we have the Clean program that help with weight management against obesity, which of course we know is the mother of lifestyle diseases. Of course, diabetes is the disease of diseases, but obesity is the mother of lifestyle diseases. And you can see that this 9 days weight loss and detoxification program that inculcates professional fasting, dieting, exercise, of course, autophagy. You go to other videos, especially maybe check on Dr. Drugs, YouTube or anywhere, lifestyle modification and all that, and weight management, and you will know more about this. Now, I'll leave us with this. You are what you consume. And there is a constant battle between factors that repair and protect our bodies and those that break it down. So we have to beware on the winning side. Remember that sugar is inflammatory. So you may hear all sorts of things like the range of blood sugar, fasting blood sugar is 70 to 125. It is not 70 to 125. It's 70 or 80 to 100. So those of you that are selling Coca-Cola, Fanta, and telling people that it is 70 to 125, so that you can make more sales even when people are having sugar 120, fasting blood sugar 180. Far acceptable. Then kindly remember that we should not adjust medication and or dosage without the guidance of a trained health practitioner. You can see this man is not joking. He's here again to give us that warning. Finally, prevention is what better than early detection. On this note, I'll say thank you so much for coming. Good night and God bless.